I'm Dr. Dilip Dhanpal, urologist. I've been in Bangalore since the last 40 years. I've been in urology since the last 43 years. Finished my graduation and qualification from Bombay and I came out to Bangalore. I've been in practice ever since then.
What is benign prostate hyperplasia?
BPH is acronym for benign prostate hyperplasia or benign prostate hypertrophy. It essentially means the prostate is not cancerous. It is called as benign. Now, this is an aging process, and almost every person, as age advances, will suffer from the problem of benign prostate hyperplasia. The gland will enlarge. If one were to draw a graph of age versus the size, the prostate size goes on enlarging after the age of 40, 45, but the symptoms come a little later, after the age of 55, 60. In diabetics, the symptoms tend to come a little early. In non diabetics, of course, the symptoms can come from the age of 60 onwards. There are a lot of patients where the gland enlarges but hardly any symptoms. But symptoms can come still later. So, this is commonly called as benign prostate hyperplasia.
What are the common symptoms associated with this disorder?
The commonest symptoms are if one were to actually pass urine in the bathroom, in the toilet, patients of enlarged prostate will have symptoms like difficulty in starting, that is, initiation. Once they start, they have difficulty in maintaining a good flow. So they pass urine, then it gets interrupted. It is start, stop kind of phenomenon. Then the third is they tend to dribble after finishing urination. So a lot of urine drops keep falling. In the end, many of these patients do not feel happy that they have evacuated completely. There is a sense of incomplete evacuation. So they tend to remain longer in the bathroom or they come back from the bathroom and again have to go back a short while. So that incomplete warding is there. These are the commonest symptoms associated with this prostate. But we have also to realize that these common symptoms can get complicated because of complications. Simple. Many of these patients could have urinary infection, so they have a urgency, they have a frequency. Sometimes there is blood bleeding in because of the prostate. Sometimes they have other symptoms because of back pressure changes. They could have renal dysfunction also. So all these are the symptoms associated with the complications of BPH. But the primary symptoms are difficulty in passing urine.
How common is benign prostatic hyperplasia in India?
It's very, very common. Anybody after the age of 60 is expected that the prostate will enlarge and cause difficulty in passing urine. So those above 60, almost 70% of the population above 60 will have symptoms of enlarged prostate. Those above 70 years, 80% will have. Those above 90 years, almost 100% will have symptoms of enlarged prostate.
How is the quality of life affected in patients with benign prostatic hyperplasia?
It gets affected very badly. There is difficulty in passing urine. There is tendency to go frequently. It does affect the symptoms, the sleep. They have to get up frequently at night, and they are never very happy that they've evacuated completely. So many of these patients, because of the frequency, sometimes urgency, the symptoms are so bad that they do not sleep well, and the next day during the daytime they are groggy. Many of these patients, because of these difficulties, tend to become unstable because they are unhappy that they couldn't pass. So the tendency to fall is also there, especially in the bathroom. So we always tell these patients, when you get these symptoms, consult a doctor, consult a urologist, and once he diagnoses, there are a lot of methods to manage these symptoms, and of course the prostate gland.